Welcome back to the Morning Boat. My name is Eric Abelos. We continue to provide the most up-to-date information on the COVID-19 response and community updates. So let's take a look at the latest. We have David Wallace in-house. David, how are you doing?
I'm doing good. Glad to be on this program today.
I'm happy to have you. So David, who are you and what's your relation to COVID-19 for Steamboat Springs, Colorado?
So, like a lot of people in Steamboat, I retired from somewhere else. I came from Atlanta, and for 20 years, I worked for the Centers for Disease Control in Atlanta in public health, in epidemiology and program management. And when I saw that our county was having an issue with COVID-19, and there was a need for contact tracing. So I contacted the health department and told them that I had, this experience in career in public health for 30 years. And so they said, great, yes, we would love to have you be involved. So I've been involved. I'm one of the team co-leaders of a 9-person contact tracing team for Routt County. And I've done that since April.
So this really seems like one of those movies where it's like, I'm retired, I'm not doing anything. Wait, you need me for one more job? That's awesome. So you got involved with contact tracing here in Routt County. By the way, thank you for doing that because I'm sure it's just constantly busy. Can you speak to that?
Yeah. So early on, it was busy, especially in June. We didn't have as big a team as we have now, and we had people were starting to come back from being isolated and do more activities, and so we did have a lot of cases. Sometimes we would have even up to 10 cases we'd be working at a time. And what happens with contact tracing is that people are tested. Usually people get symptoms and come down with the typical symptoms of fever or chills, body aches, loss of sense of taste and smell is a very common positive symptom. That if you have that loss of sense of taste, there's a good chance that you're going to test positive for the COVID-19 virus. And so we would get contacted through public health that, all right, someone has tested positive, we'll have their information, and all that's kept confidential. And then as contact tracers, we would call the positive case and then talk to them about who are their close contacts and who have they been around since their symptoms started. And we use the CDC, the definition from the Centers for Disease Control and the state of Colorado about who is a close contact. And that is someone who you've been around for 15 minutes or longer, less than 6 feet away. So we take, and then if you are a close contact, then you'll be on quarantine for 14 days. And we take that very seriously. We know that quarantine is difficult and a burden, so we don't take that lightly.
Person one has COVID. You reach out to his or hers close contacts. So let's say there's 5 of those. Of those 5, you call those 5 and tell them you just need to self-isolate just in case. What if one of them tests positive? Does that 5 then have another branch of 5, or like when does it stop?
Well, and sometimes that happens. That we'll have I had a case just a couple weeks ago where had a family that the father tested positive. So the mother and the children were all close contacts. They're all quarantined, in their own home. A week later, the mother tests positive, but the children all tested negative. So that was a great thing that there was some protective effect, apparently, of these young children that even though they were all around their dad the same way, mom tests positive, has to go on isolate and continue to quarantine. She was already on quarantine, so now she's on isolation. And the kids still continue to quarantine, but they ended up testing negative. But yeah, that happens, and it is like a spider web that what we're trying to do though is get to people soon enough, then tell them they need to quarantine and be careful and wear a mask, try to stay in a separate room from your family in your house, that kind of thing, so not to infect other people in the household.
What if it's a suspected COVID-19 case? And what I mean by that is somebody comes in with all the symptoms, but they don't test positive, or they get tested, but the test takes 48 hours, or it used to take like a week. Like, do you wait until you get a confirmed the confirmed positive, even if it's 48 hours, before you go and make that contact tracing those efforts? Or do you say, yeah, this is probably one, let's start it now as a preventative measure?
We usually don't usually hear about the case unless it's a positive, unless it has to come through the health system somehow, either UC Health or our own health department testing. So they've been tested, and then if it tests positive, then that's what triggers it all for us to be notified. Yeah.
Okay, so if it is 48 hours for them to get the confirmed positive, within that 48 hours, they're kind of advised, or they, probably what we've been telling people all along is if you're feeling ill, stay isolated.
Yes.
So that's probably good. Okay.
Right. So really, people should be kind of monitoring their own symptoms, and if they know they've possibly been around a COVID-19, positive, then they need to be careful about, okay, how am I feeling? Monitoring their own symptoms. If they're starting to feel sick, they need to be staying at home. They need to, get tested. But that's how, that's part of the prevention that, everyone, has a role to play here in trying to stop, the virus transmission. And that's mask wearing, is very important in public, out in public places. It's been clearly proven from the CDC and other scientific organizations that mask wearing is effective and protective. There was a good example in Missouri of two hairdressers who came down with COVID symptoms early on, but still continued to work. They didn't get a test right away. They just didn't know about their symptoms, but everyone wore a mask. All their clients wore a mask. These two hairdressers, they wore masks when they're cutting hair. They saw 139 clients, and no one tested positive from that. So that was hugely show the beneficial effect of mask wearing, even cloth masks. That's what these were. So that's protective. Being outside is much more protective than being inside. Being in a smaller, keeping your group small, avoiding risky situations, and just being careful about what you're doing on your travel. Early on, we had lots of cases that people got on airplanes and they flew to Texas, they flew to Florida, flew to Mexico. And whether they got it on the plane or they got it when they're there, but they come back to Steamboat, and test positive.
I believe that single-handedly, the contact tracing efforts have been instrumental in keeping our numbers as low as they have been. Thank you so much for doing this.
Yeah, I mean, it's we hope we're doing having an impact. I know we're doing the right thing. We're trying to do the best we can, and most of the people we talk to they want to do the right thing too. They're trying to isolate themselves, quarantine themselves, be careful around their close contacts, in trying to stop the chain of transmission here, and that's really important. If we can all just do that, then the virus will diminish. Hand washing, mask wearing, being careful about your groups you're in.
Have you found that people have been once diagnosed or once they've been reached out to you guys or you have reached out to them, have you found that people have been violating their like stay at home, like self quarantining, or are people pretty like compliant with, okay, I know somebody, I should really stay home?
I think most people are trying to do the right thing. Um, and most people are quarantining, staying quarantining at home. We don't know exactly, what people are doing. We follow up with our close contacts and our cases about every couple of days. We'll reach out to them, ask them how they're doing, how their symptoms going, things like that, and just thank them and remind them about the need to continue to quarantine, and thank you for protecting your family, your friends, and our community.
Well, thank you so much for joining me on air today. I really, really appreciate all the work you are doing to help keep our numbers as low as they have been. And it's truly without your efforts, we wouldn't be seeing the numbers that we're seeing. So I greatly thank you.
Thank you, Eric.
All
Okay,
right.
great to be on the program today.